Now, please welcome Congressman Greg Walden for a conversation with Bob Cusack of the Hill.
Please hold your applause.
This is right before lunch, so this is going to be a challenge. But lunch is coming soon. Congressman Walden, you are actually the leader in the House in town hall events, and you're doing a lot. You told me backstage before around the 4th. What are you hearing at those town hall events, and how much of it is healthcare related?
Well, good morning. And frankly, there's a lot on healthcare, and a lot has to do with surprise billing or cost of care. Now, Oregon stepped up and sort of resolved the surprise billing piece, much like the legislation we put forward in draft form. But cost of care, access to care, these are big issues for people, especially as your health insurance continues to have higher and higher deductibles and copays. More of that's coming out of your pocket, and people go, how come this costs what it does? How come my drugs are this expensive? Or I went to the hospital and this happened. And so it's a big issue.
Do you hear a lot of surprise billing?
Not
issues?
a lot in
Okay.
Oregon per se,
Okay.
because Oregon stepped in as a number of states had and figured out how to prevent that. But we do know it's happening, and we do know people are reading about it or hearing about it or watching it occur, in other states.
Mm-hmm.
And it's like the woman in Texas who had back surgery, and on the way out, they had her do a urine test. It got sent to a lab that was out of her system, and it cost her $17,800 for a lab test. You only have to see that once on TV and go, that could be me. And you don't know Oregon's already got this covered, but if you're in a state that doesn't, this is a big problem. Or the woman who testified before our committee the other day, who several years ago, her son was born and turned out he was hemophiliac. And so when they did some initial things, he started to bleed out. So they came in and said, we got a real problem here with your son. We're going to have to take him to the neonatal intensive care unit down the hall. And she's like, yeah, whatever, And then a month later, she got a $50,000 bill because while the hospital was in her network, they had contracted out their neonatal intensive care unit to an outfit that wasn't. And she said, when you get the diagnosis that your child who's just been born is a hemophiliac and needs emergency treatment, you don't go, wait, I got to check my plan.
Right.
You're already in the hospital. The plan's in the hospital. How the hell does that happen? And so people see these stories, and they're demanding accountability, they're demanding action, and they want transparency in pricing.
Politics in the last several years has gotten so vitriolic. A lot of it is been focused around health care and the Affordable Care Act, the fights over Obamacare, repeal, replace, all that kind of stuff. There has been bipartisanship, 21st Century Cures Act, which I know your committee worked on. Opioid issues and bills have passed on a bipartisan basis. There's a lot of talk now. The White House is interested in drug pricing. What do you see happening, if anything? And I would imagine it has to happen soon because the 2020 season is already upon us.
Yeah, debates are tonight, aren't they?
Yeah.
Well, for the Little League, then the varsity comes later, I guess.
Well, Elizabeth Warren may not like that characterization.
Just having a little fun here before lunch.
Now, will you watch the debates?
I may see some of it, yeah. I'm actually on a plane tomorrow night, so I won't see it. Back to Oregon, my 416th round trip, and I start 13 town halls starting Friday morning. So I probably won't see it on the plane. But, so what about healthcare? So I'm glad you mentioned opioids. I think it's singularly the biggest legislative effort to attack a single drug sort of issue I think the Congress has ever undertaken. If you look at the money we put there, if you look at the various policy initiatives, we took 60 pieces of bipartisan legislation, wrapped them up into H.R. 6 after they passed the House. The President signed into law in October. I think actually the markup was, or the House passage was a year ago last Saturday. And we're making progress there. It was all bipartisan. Our work on 21st Century Cures that my predecessor as chairman, Fred Upton, led with Diana DeGette. Bipartisan investments in medical research, unprecedented probably in the world in terms of the focus for medical research and breakthroughs and cures. And if you talk to Dr. Collins from NIH, he'll tell you now with CRISPR and all their technology, everything, they've now identified the misspelling in your genetic code of about 6,500 diseases. That they know what's wrong, they don't know how to go fix it yet. Mm-hmm. So we're making remarkable progress in that front. But all of that is wonderful except if you can't afford to use your insurance because your copay is higher than what you have in the bank, and you see these statistics, say a certain percent of middle-class Americans couldn't come up with $400 in a crisis. Now, I don't know, does that mean they don't have 400 or they'd put it on a credit card? I'll let the Fed explain their data. But we all know people who go, I think I'll put off getting access to care because of the cost of my share of that. And that's driving this issue on transparency.
How do you grade the Trump administration on health care? The president has been pushing the party to try to become the party of health care. Polls suggest that is definitely not the case at the moment. What do you think the administration is doing well, and what do you think maybe they could do more of?
We've never had a chief executive in my time in the Congress, which is 20 plus years, that has leaned in more on drug prices, on transparency, on surprise billing, all the things. And and you know, you've interviewed him, I've been around him, he is committed to this cause. And whether it was the right to try legislation I worked with him on, whether it was reauthorizing how we approve drugs, and that was another one that was unanimous, the FDA reauthorizations. And we opened the door for quicker access for generics to come to market. And under the last year of Scott Gottlieb as FDA head, they approved, I think, 971 new generic drugs, the most in any single year. And we put a provision in to deal with the EpiPen situation, where if you've got a competing product, you get to go to the front of the approval line if there's nothing there. And so we're putting consumers first, and he is. And the president is, you know, I've been down there a number of times. I was in the meeting with the CEOs of the pharmaceutical companies in the Roosevelt Room in, I don't know, February, March of 17, when he leaned in very hard on them with the TV cameras in the room. And then when the TV cameras left, he leaned in and said exactly the same thing. He said, you got to get your prices down. Americans can't afford this. And yet there's an understanding we also don't want to go so far we cut off innovation and all those things. But there's squeeze here to be had.
When do you think Republicans will come together and have a unified health care plan?
Well, look, I would argue that our primary job is to go fix the problems that are there. And by the way, we're in the minority in the House. I'm chairman in exile. I'm just waiting my return. And so we do have plans. And you're seeing it play out because what we're addressing is what consumers care most about. Remember, there are 158 million Americans that have health insurance. And if you look at the surveys, they like the health insurance they have. The work we did to get the economy in overdrive, there's 2.5 million more people with health insurance through their employer today than when Donald Trump took office. It's the Democrats who want to blow all of that up. And frankly, with their Medicare for All, you're in effect repealing Obamacare, and you're taking away all the insurance people have. Now, are there market things we need to work on for that 3 or 4% that are on the individual market to make their plans more affordable and available? Sure. But in the meantime, the most important thing we could do is get down the high cost of health care in America. And if I'd remained chairman, that was going to be my single priority on the health care space, because it is about how do we get people access to their pharmaceutical drugs. You know, we repealed the gag rule. I had a pharmacist in Grants Pass, Oregon, Michelle Belcher, tell me that if somebody came to her counter, she was not allowed, because of contracts, to tell them if you just pay me directly for that drug, it's X. If you do it through your insurance, your copay is going to be such, it's 2X or 3X. She was prohibited from having that discussion with her customer. We banned those kind of gag clauses. And so, I mean, we've done a lot of this work. There's far more to do. But it is about getting access. We also need to fix telehealth. So my district would stretch from the Atlantic to Ohio. Not making this up. I've won a lot of bets on this with my colleagues who tell me they have the big district. 69,491 square miles. So I got 3 counties, no hospitals, no doctors. They rely on PAs or nurse practitioners or telemedicine. We need to modernize telehealth in America so that you can cross state lines and have access to care and the specialists. You know, my district borders Washington, Idaho, Nevada, and California, and the People's Republic of Portland. That's just kidding. And so, you know, there are things we need to do there. Get broadband out. Get access to providers. There are issues in reimbursement in rural to rural. I mean, there's all kinds of these legacy policies back here that Congress needs to figure out answers to get modern medicine into rural communities.
Is the lack of broadband a big issue in your
Can
district?
be. Yeah, it depends upon where. I know all the spaces where there's no connectivity. I like to hide from my staff there. They can't call. But it is. And part of this will be fixed to a certain extent with 5G, because most of us are going wireless. But you still have to have the fiber backhaul. And there is build-out going on. And where it does exist, everything changes. But if, we have a broken VA system. We have medical records issues. A lot of this can be dealt with new technologies, but you have to have the connectivity. So yes, I got an area in my district that last fall, little tiny town of Seneca, Oregon, there's probably literally no more than 30 or 40 people there. The city manager had to drive, 30, 40 miles away with their laptop to get access to the internet to do what she needed to do for the city because the service there had been out for like 6 weeks. I had a little phone call with the carrier, but that we're facing this in rural America. You also have this problem in urban areas too, but it's really predominant out in the rural areas.
A lot this morning we've been talking about cost, where seniors have and other patients have talked about out-of-pocket costs and how they're on the rise, and provider groups have said that they're not reimbursed enough. Former CMS Chief Tom Scully says provider groups have never complained about being over-reimbursed, but cost is always an issue. You have Medicare headed for bankruptcy. How is that going to get fixed, and how do you deal with the cost issue 5, 10, 20 years from now?
Oh, I think there are ways. I really do. I think transparency is a good way. I think more competition is a good way. Nobody knows what any of this stuff costs. Does anybody tell me what their MRI costs at this facility versus that one versus that one? What the president's doing with the executive order is going to help a lot. And there's going to be howling and screaming from the insurance industry and the hospital industry. Look, the medical industrial complex in America puts the defense industrial complex to shame. And it's powerful. There's enormous money. It does amazing things to save lives. But we've got to get a handle on the expense, and you got like one more chance to do that, or the public's going to throw up their hands, and you'll get a nationwide system. You'll get a single government system, and then we'll wait for care and wait for access. And so I think more transparency is a good thing. I'm an old journalist, a journalism major, and I believe in open government. I believe in transparency, because then you empower consumers, and nothing will drive change faster than consumer behavior. Just look at Amazon and what it's done to retail, because it's more convenient. This is not an ad for Amazon, but it's more convenient. It's right there. You get choice, you get price, you get competition, and it arrives at your door the next day. And so I think this has to come to healthcare. Industries that are so overregulated, like healthcare. I was on a community hospital board. I've been in health policy in the state legislature and here. I was an employer that paid for health insurance. This stuff's so complex and so overregulated and so hidden behind the curtain that it's going to get changed, and it can be changed for the better, or you'll just have full government run in healthcare, and I don't want that.
We have a few minutes for questions, so if you have a question, please raise your hand, and we can have a microphone get to you wherever, who's ever closest. And if you can just identify yourself and ask the congressman a question. You can count that as this is a town hall on your tally, I think.
Oh, no. Good. Yeah, you're a lot more polite than some of my town halls have been so far.
It's on already? Okay.
Where are you?
Hi, Congressman. Hi, here I am. My name is Max Johansson. I'm a graduate student at GW. So it's great that you want to instill some negotiation or price controls for drugs. That story about the hemophiliac child is obviously horrifying. Where is the zeal to have the same control over negotiations for price for procedures and inpatient stuff, like services rendered? Controls, there's ample evidence from South Korea, Japan, Germany, and France suggest that those kind of price controls actually stimulate competition by forcing the makers of certain devices to create more efficient and cheaper machines, like the MRI example you just listed. Thank you.
Yeah, sure. I think you can do this across the platforms. I really do. And I'm not here to say I'm going to do price controls. Remember our surprise billing law. There are different ways to do this. New York does it through arbitration. Oregon chose a market-based pricing mechanism. We're going to figure this out in conjunction with the Senate. It should never have come to our doorstep, by the way. right? The last place this should be resolved is in Congress. It should have been worked out so customers weren't getting taken to the cleaners on their bills. This is my point about lack of transparency through the whole system. Look, if you think about what modern technology has given us in every other space, or virtually, I can go on Kayak and find out the best flights and the best prices right now sitting here, except Zach's got my phone, right? And I could book that flight. I can get a hotel. I can get a rental car. I can pick the rental car from Avis I want. They tell me it's an L15 when I land at PDX, and I go right there, get in, and go. Why do we have a healthcare system like this that's so bureaucratized? And people can't afford it. I mean, this is the thing. Whether you're an employer like my wife and I were for 20 years, we never could figure out what the price increase was going to be on our health insurance for our employees. All we do is throw a dart at the dartboard, and we had no competition. I couldn't buy health insurance across state lines. I couldn't group up with other small employers. We only had 10 or 15 employees. I had no power. And then on the hospital board, we were a little rural, independent nonprofit, and one of the big insurers came in. We hadn't raised our rates in 6 years. They said, we're making you take a rate cut, which we couldn't have sustained, but we couldn't turn away Blue Cross either. We ended up having to merge with a bigger outfit, or we were going to probably not be around in 10 years. And so you got market pressure issues here. You've got lack of transparency. And I think if there was price disclosure on procedures and services at every level, it gets back to my pharmacist example, Michelle Belcher. You know, how was it there was a contract that said she couldn't tell you as a patient at the counter, by the way, if you just pay direct, it's this, versus go through your insurance, it's this plus this. That's what's wrong with the system, in part.
Another question?
Oh,
It's
hi.
working.
There you
Here we are. Pascaline Cleric, I work for GenFit, a biopharma company. We're working on developing therapeutic for fatty liver disease, which is a disease that's associated with type 2 diabetes and obesity.
Good.
There's a lot of heat taken by the pharmaceutical company, by the insurance company, but when will we bring the food and beverage industry in the conversation around healthcare costs? Because obesity and diabetes is really driven by what we eat and what we consume, and they have a part of responsibility in the equation.
Yeah, diet matters, clearly. I get that. I'm more of a free market person on those choices. I'm not going to say how many ounces you can have and ban anything beyond that. But I believe in education. And I think you're seeing consumers change their eating habits based on education. Because people are saying, maybe you don't need that much sugar in your diet, or maybe you don't need that much salt. You don't think that's true? Okay, so, yeah, right? So how would you regulate them? Can we get her the mic, too? Well, let me ask you that question. I'll turn it back to you. What would you like us to do?
Regulation on what goes, and it goes to children. We have physicians who tell us that they see 12-year-old kids showing up with cirrhosis who will be on the liver transplant list because they have high corn syrup food, processed food in their diet. So it goes by, changing like what they eat, changing at school, but also like the food desert. There's like plenty of areas in the United States where people don't have access, not just to healthcare, but access to food that is needed to stay healthy and be healthy. Mm-hmm. And so how do we, support those community? And it goes like the prevalence of this disease is 19-20% in the Hispanic population. The next generation, I think this prevalence will go even higher. So how do we bring this, is it a tax on corn syrup? Is it a tax on what do we need? What is needed for the food industry to understand that what they're putting out there is creating
right.
healthcare issues and chronic issues?
Yeah, I think in part, certainly you do that. Again, I'm going to go back to education first, because you can tax something. It doesn't mean people won't keep using it. But if they know it's bad for them or they shouldn't have certain amounts, I just think you look at our school lunch programs. That's a good place, right? And there have been huge changes in what's available in schools. School boards can do this, and they should. So, but if you want Congress to write a law that says, you know, you can only have this much fructose in syrup in certain things, or ban it altogether, I wouldn't hold your breath on that. I just don't think that's going to happen. And things are, you know, studies are going to come out. There's going to be new evidence and different things. I mean, and so I think it's better to educate people about proper nutrition, and where there are gaps and holes, then we need to go figure that out. We certainly have programs to do that. Maybe you need new restrictions on what people can buy with their food stamps too. I mean, there are a lot of folks that Oregon has the Oregon Trail Card, and I don't know what those limitations are, to be honest with you. But you know, we all see different purchases at grocery stores. Look, nutrition matters. You're seeing that in everything. But I don't think you're going to see, you know, a soda tax or something like that go through the Congress.
Unless Bloomberg becomes president, maybe.
Well, there you go.
Yeah, but he's not running. So anyway, we have run out of time. Please thank Congressman Walden for joining us at the
Thank
Healthcare Summit. I hand it back to Brittany.